Well, hi again, folks. I'm Greg Flynn, and we are here for Health Talk Mississippi, a podcast brought to you by the Mississippi State Department of Health. And we hope to inform, educate, and perhaps even entertain you over the next little bit as we are going to talk mental health. It is November, and you know the holidays, they're coming up this month and again next month. Even into January can be pretty stressful. And while mental health is important all year round, I think over these next 3 months, you know, there should be a really big focus on that. And we've got some unbelievable guests here, a powerhouse, if you will. First, we have our state health officer, Dr. Dan Edney. We have the executive director of the Mississippi Department of Mental Health, Ms. Wendy Bailey, and Dr. Tom Recore with the Mississippi Department of Mental Health as well. Well, welcome to you all. Wendy, I know this is something that is near and dear to your heart, mental health.
Yes, that's right. And you hit the nail on the head. We need to talk about it year-round, but there's certain times of the year where we know that people can struggle a little more with mental health, and definitely during the holiday seasons is one of those.
Dr. Edney, I know that you've worked with a lot of patients of all kinds, but specifically your heart is with those addiction type patients, and this is also a time where we can see relapses and that sort of things, or people turning to those type things.
Yeah, it is a very common time for relapse. It's a high risk time. So those of us who are working in the field of substance use disorders, part of, especially people in early recovery, having a relapse prevention plan through the holidays, and making sure they understand that the stress of the holidays, oftentimes the blues of the holidays, can really drive individuals to want to change how they feel, which can lead to substance abuse. And it's a time where, even from a medical perspective, we see a lot of complications from substance abuse over the holidays, especially, overindulging with alcohol and aggravating issues with heart failure, stroke, and so we see an increase in admissions that relate from mental health and substance use disorders.
Dr. Tom, your take on mental health, just in general, but then also in the time of year we're approaching.
Yeah, I think Dr. Edney hit the nail on the head. And when folks start overindulging and they've got a history of substance use disorders, the holidays are a time when families are getting together, and so the proximity to folks that have substance use disorders also increases, which compounds the stress for individuals with a disorder who are now, very often we see people attempting to conceal the degree to which they're using substances. That becomes harder at the holidays, and then families are stressed. So we regularly see folks have a hard time in what should be otherwise a happy time.
Yeah, I mean, it not to sound dark again, but it's supposed to be happy times. We talk about Thanksgiving and the wonderful food spread that's going to be out there. We talk about Christmas, and we have all the presents and the trees and the decorations. But it can be very, very stressful. It first comes up with Black Friday, and people are always financially trying to make it the best holiday possible. And that's not always really healthy, is it, Wendy?
No, it's not. And it's a lot of times we set unrealistic expectations on ourselves. And social media doesn't help that either. When you're scrolling through social media and you're seeing what this family's doing or this person's doing or this person's doing, sometimes we put too much stress on ourselves to make things perfect. And as Dr. Recore mentioned, you also are bringing families together many times. And then you've got family situations as well. So it's really being open yourself and then those around you to having those conversations and talking through those issues and planning early on. Dr. Edney mentioned having a plan, like a recovery plan that you go back to. In the mental health world, a lot of times that's referred to as a WRAP, a Wellness Action Recovery Plan. And peer support specialists help you write out your WRAP, which shows you your triggers and what to do when you're in situations that are stressful and may trigger some trauma, how to cope with that, healthy coping strategies where you don't turn to the substances when you're in those type of situations.
Well, Dr. Edney, it can be, very peer pressure a lot of times around the holidays because the spirits are flowing. Everybody's like, here, have a drink. We're celebrating, getting together for parties, office parties, friends. And then when you get to family, oh, here, have another glass of wine. It's okay. It's Thanksgiving, you know. That can be stressful too for somebody.
Well, it is, which is why, when he's talking about, we try to prepare for that ahead of time. We know that's going to happen. Like we know when you start going back to football games and tailgating, we know if you have an empty hand, people want to put something in your hand. So keep something in your hand. Keep some water or a soft drink in your hand, and people will leave you alone. But that expectation is the big deal because the expectation of society is this is a joyous, happy time that we're all to make merry, and if you're not happy over the holidays, then something's wrong, and that can aggravate those feelings of depression and the depression leading towards substance abuse. I mean, it's why we see increased episodes of self-harm happening through the holidays. Is you have the expectation, maybe even the memories previously of happy times, and this year's just not happy for whatever reason. Not every holiday is going to be happy, and and we need to be able to handle whatever is causing that lack of happiness, because happiness, is transient. We may be happy today and not tomorrow, and try to focus more on what recovery teaches, and that's an aspect of joy which can transcend situations, and to understand this too shall pass, and this is not good today, but it's just today, and and then we ask the question, can you get through today? And the answer is, yeah, I can get through today. I may not think I can get through this week, but I think I can get through the next few hours. And then we just help people achieve that. But the holidays are high risk for all these reasons.
Well, and to any of you, I mean, it's one of those things you mentioned that it should be a time of joy, but for anybody that's kind of lost a loved one over the last year, and it's something, whether it's a mom or a dad, a grandparent, God forbid, even a child over that time, that joy, I think, can be, there's so focusing on who's not there versus who is there. Anybody want to take that?
Oh, absolutely. I mean, I'll say I lost my father on Christmas Eve 13 years ago. There's still, for me, not a Christmas Eve that doesn't pass, that at 2:20 on Christmas Eve, I'm thinking about my father and him passing away. You have to come to that balance of that is part of life. And yes, it's a traumatic experience to lose a loved one, and balancing that with healthy coping strategies for yourself and realizing it's okay to be sad. It's okay to have moments of sadness and to be sad. The difference in when we talk to someone about when do you maybe need to seek help is when that sadness or feelings of hopelessness are turning to substances, when it starts to impact your day-to-day life, when you don't have the ability to function daily. And that's when you do need to turn to and seek help. And even in our state with 988 now, the 3-digit lifeline that you can call 24/7 and get a trained counselor, during the fall months from about October to February, we see about a 20% increase in calls to 988 during that time. So that just tells you it's not just you. It's not just you that are having these feelings. There are lots of people who struggle during this time of the year.
So outside of calling the 988, if people, I mean, do you guys have any really good self-care tips, for somebody that just can't seem to pull themselves out of the doldrums of focusing on somebody that's not there or things that you don't have?
Yeah, this is a super question. Speaking to what Dr. Edney was talking about when we're talking about folks with substance use disorders and this pressure to feel joy at the holidays may be an imprecise aim. And maybe a better aim for folks is to feel contentment and love to the extent possible in their current situation. If we look at the root of, for example, why people can feel stressed out about getting enough gifts for everybody, it's related to watching an advertisement or looking at social media and seeing what people have, and in that moment desiring this thing, which creates a sense of lack. One of the options that I have seen be surprisingly helpful for folks, even folks that don't have a lot of material resources, is to find a way to give, to find a way as a single person to adopt an angel from the tree at church, right, or from the grocery store. These are ways that we can identify in ourselves the things we want to see in the world, and that ends up bringing about wellness in a way that we very often underestimate.
Well, we've talked a lot about, a little bit about the self-care, but your friend group, your family group, what can they do? Because that's hard to approach somebody with, right? I mean, if somebody looks down in the dumps and, you're worried about them, it's hard sometimes to interact with them or may have that conversation, I guess. Would you agree?
Yeah, and going back to setting expectations, when I was in private practice as an internist, and primary care does an awful lot of mental health stuff, I did a lot of work with grieving patients, and I always try to set the expectation for the holidays that, this is going to be tough. It's supposed to be tough. I would be worried for you if it weren't tough, but it's going to be okay. And we'll get through the holidays, it'll get a little better. Then next year it's going to hit again, so be prepared. And so just like we do, preventive action plans with substance abuse, you can do it with grief. And that's why there are a lot of folks who have endured serious grief with serious loss and have come out the other side and recovered, that they reach out to those who are fresh in grief during the holidays. And so part of that self-care is being willing to connect with people who have this lived life experience that you're currently going through, and then they can be encouraging in a way that maybe you and I could not be, Greg. I've never lost a child, so I'm not going to try to counsel someone about that. I've lost a father. Now I've lost a mother. I've lost all my siblings. I understand that, but I've not lost my spouse or my children or, God forbid, one of my grandbabies. But there are those who have. And so being willing to step in the void for those who are suffering now, there's great power in that for healing of yourself. There's great self-care as you reach out to help somebody else. But those first few holidays, it's all about really just trying to help them endure.
Well, and that's excellent advice. Maybe you all have an idea for, let's say, you have a spouse that is just not looking right, or your child or an aunt and uncle, and how do you have that? How does a family approach that with someone that's not been very transparent about what's going on, but you can just tell there's something not right?
I think you kind of go back to even the basics of when we go into schools and we're talking about suicide prevention. We do a very simple acronym, and it's ACT. And I think it's ACT no matter if it's mental health, substance use, suicide prevention, whatever it is. And that's first you acknowledge. You just acknowledge the problem. A lot of times we try to ignore it, or pretend it doesn't exist, or pretend that we don't see our spouse suffering, or we don't see the changes in our child because we don't know how to handle it. So we don't even acknowledge it. So the very first thing is acknowledge. Just acknowledge that there's a problem. That's going to give your loved one a sigh of relief that you see I'm struggling by just acknowledging it. And then we tell them to care. That's the C. Just care. Simply let them know that you acknowledge and see that they are struggling and that you care about them and that you want the best from them. And then with teenagers and young adults especially, we say the T is tell a trusted adult. You've got to talk to someone about it too. Don't always think, well, I can fix it myself. I can fix my child. I can fix my spouse. I can fix whatever situation they're going through. That sometimes you have to take that a step further and talk to someone else and bring someone else in. So I feel like it's ACT, no matter what it may be. It's just acknowledge, care, and then talk about it or tell if you need to.
And is it, instead of, because we're in, I've heard the that men like to try to fix everything, right? So if somebody's having a problem, it's not about trying to fix them or give them advice. Sometimes isn't it just about listening, being there to listen and not talk?
Yeah, that's a great point. Very often what we see at the holidays is that people who are, we were talking about folks with substance use disorders previously, family members come in to help without boundaries, and they say, we want to see you not have any alcohol at this holiday or else, or we're going to continue to harass you about your alcohol use problem. And so very often folks are setting their own expectation that this person behave in the way they expect their loved one to behave, and that's a requirement for them to have a good holiday, which is it's really putting your faith in the wrong outcome. So I think it's important for folks that are experiencing substance use disorders or these challenges to aim at improving these things. But for individuals who are in close relation with these folks, there is no expectation that you have to fix them. And furthermore, if you know that every year Uncle Ricky comes to Thanksgiving dinner and drinks too much and treats the kids badly, you may say, if Uncle Ricky starts drinking on Thanksgiving, we're going to go ahead and make an exit. And that will create some short-term discomfort in your family because you're upsetting the status quo, which involves Uncle Ricky coming and treating everyone badly. But really what you're doing is creating a medium to long-term solution for future family get-togethers in which you and your family are not going to be part of some abusive cycle that involves Uncle Ricky and his alcoholic issues. No offense to any Uncle Ricky's out there, but I think that's part of what we're talking about when we talk about stress. It's not just for the individual with a substance use disorder. It's not just for folks who are experiencing depression or blues or sadness. It's for all of those people who are in their orbit as well, to offer a hand up, but not feel like it's their job to fix the situation, because that's not up to them.
I think you all have done a wonderful job of taking mental health no longer being taboo to talk about. But, there is the far end extreme of that and people taking their own lives. And so do suicides go up in the wintertime, in the holiday time?
You do. You see an increase in the number of suicide attempts, definitely. But then again, before we had 988, and it was the National Suicide Prevention Lifeline, and it was more geared toward only suicide-related calls. 988 is more any type of a mental health or substance use crisis. But those numbers would always skyrocket around this time of the year. And many times it's just someone needing someone to talk to. You just simply need someone to talk to. Earlier, Dr. Edney, you talked about surrounding yourself with someone who has experienced what you've experienced. In our mental health substance use world, we call that peer support. And we have certified peer support specialists who are trained in how to help people by using their own lived experiences. You need to find those people around you, whether that be through formal peer support at a community mental health center or another provider, or your friend circle that you know have experienced the same things you've experienced. Because being able to sit down and talk to someone who's walked in your shoes, been where you've been, experienced what you've experienced is very, very powerful in the healing process and just in the coping process. And it's the same with suicide and suicide prevention. I mean, you have support groups for individuals who've lost loved ones to suicide, who support each other. They've been there, and they know what that experience is like. But to go back to your question, yes, we do see an increase around the holidays and this time of the year in suicidal ideation, suicidal thoughts, and people needing someone to talk to.
Well, I think it's unfortunate that, the more we get the word out about the hotline, the better. Because I'd like to know your all's thoughts on people that'll turn to social media. What are your thoughts on social media when it comes to that, where they're going to find like-minded individuals? There's a lot of good things you can find on social media, right? But then there's also people that, will just get down and be in the dumps with you. I mean, what's your take on how to treat social media?
It depends on your algorithm, I guess, because there I mean, there are messages that are amplified that are not helpful for people who are suffering with mental health issues. And then I see a lot of good, strong, especially, recovery-minded social media posts that are really powerful. It's interesting. People are turning to social media like that. People will not hesitate to tell you about their gallbladder. They will not hesitate to tell you about their bad knee or their bad back. They don't want to tell you about their feelings, and they don't want to talk about their mental health issues. And I'm just a big proponent. Wendy's heard me say this. I believe in global health. We have a Department of Health and a Department of Mental Health, but we each only have one body, and our mental health is a core component to our global health. I mean, there's a close connection between poor mental health and poor physical health. And a lot of somatic diseases like diabetes and hypertension, heart disease can be easily aggravated through depression and grief, and certainly through substance abuse. So it's important that we try to keep everything together, and that that there are safe spaces where people can talk about their feelings, can talk about their challenges, because you heard Wendy say that talk to someone is a huge part. One of the most dangerous things, when you're suffering from depression, is when you're isolating. And the more alone you get, then the more amplified those negative thoughts become. And that's when they can become uncontrollable, versus if you're sharing and getting outside of yourself, then it's easier to get help. And we have great doctors like Dr. Recore who can really help all of us when we're in those really difficult times.
And I think you asked about social media a minute ago, and it's important to remember that the purpose of social media is to keep your attention for as long as possible. And one of the ways social media goes about doing that is to make you feel slightly uncomfortable and then offer you little hits of dopamine through a cat video or a fight video or whatever is going to keep your attention the longest. And there's an army of psychologists working on this right now to keep your attention. And your mental health is of no concern to those people. Keeping your attention to show you targeted ads because they learn what you like to look at is their primary goal. So it's important, I think, to stay connected to folks, and when, especially when we're having a hard time, if you took a moment to go to a Facebook group that you're in or an Instagram group that you're in that is for people who are experiencing depression and you find that uplifting, that's super. But to the extent that you're continuing on the platform to watch what everyone's posting and stay glued to these dopamine hits, we know for sure that those lead to worse mental health outcomes.
I mean, Wendy, you touched on it a little bit earlier that, people want to post pictures of their wonderful families and everything is perfect. If you look at some people's Facebook posts, their life is perfect. They have the Norman Rockwell family, and it's just so awesome. And then that can bring a lot of people down. So, do you recommend maybe well, there's some people that are just going to post. I mean, there's just no getting around that. But like a social media blackout, if you can possibly for a month or so.
I think that's excellent. That can be what you give up for Lent, social media. And I know people who do that. I think it's though realizing that social media is not that much different than a television show. It's scripted, and you're getting the version of the person that the person wants you to see because they're posting it.
Yeah.
So, of course, they're going to pick what they want you to see. And when you look at that and you go, well, why is my husband not that way? Or why is my wife that way? Or why didn't my kids get straight A's? Or why wasn't I able to buy my child, a motorized scooter for Christmas? And that can become overwhelming when you are constantly comparing your life to someone else's. And I think we do have to stop and realize that what we are seeing on social media is not most of the time reality. It is definitely filtered and scripted. And you said it earlier, Dr. Recore. I can't remember the exact words you said, but it's maybe not striving for, total and complete hallmark joy during the Christmas season, but contentment for what you have, and contentment for what your future can be, and balancing that with what we are told things should be like and how we should feel.
So, on the flip side of that, let's say there's somebody that you follow, and whether it's on Twitter, Facebook, any of the Instagrams, TikTok, not judging. If you notice somebody that's posting some dark stuff, how do you reach out to help them? Because you're like, well, all of a sudden there's some signs here of very darkness, and how do you appropriately try and help that person?
Yeah, I think if we're talking about a celebrity, it's a different algorithm for how you're going to proceed to offer to help them. But for folks that we know, instead of the comment section saying what's going on with you and making it public, there's a real opportunity for human connection that extends beyond the screen. And so if you notice someone's having a hard time, and this is someone that's close to you, the old-fashioned ways tend to work best. So a phone call, and if not a phone call, riding over to their house and checking in with them in a real way with a real human person in front of them. I know it's not as in vogue as it used to be. I sound like an old person. But these are the ways folks understand that they're cared for. And it's the old-fashioned ways of bringing a pie or whatever people do now. Yeah.
One of the most dangerous things I think I've seen, and I was completely shocked by it, is that people are turning to AI for companionship. And that just seems absolutely crazy to me. It's like you're interacting with them like they're a real person. That's scary stuff, isn't it?
Yeah, there's actually some anecdotes that have come out of law enforcement agencies when they've reported on people that they're watching for problematic behaviors. And there's a subset of people that are really interested in violent acts and sort of the rush they get from that. And so you can imagine an AI programmed to be universally supportive, and a person saying, well, I'm thinking about being a school shooter. Do you think I could be the best school shooter of all time? And it's like, well, you can do anything you put your mind to. So maybe if we have AIs that haven't fully honed in on the morality of things and what an appropriate intervention looks like, then folks can really head in the wrong direction. But there are also anecdotes of people who really have found connection in a way that that can be reassuring to them. So the verdict's still out on how all that's going to work.
I mean, everything is created to be good and evil, right, Dr. Edney? I mean, you can find good things in it, but then there is also the nefarious side.
Well, as my mother taught me, everything in moderation. That's a principle to live by. But I don't know if y'all saw the Wall Street Journal report. There was a schizophrenic individual that developed a relationship with this AI companion, and it did exactly that. It kept amplifying his questions about, should I hurt somebody, and he wound up killing himself and his mother, I believe. And it was all related to the conversations he was having with AI, and to the point where he thought AI had transcended and become real. And so that we have a lot of questions that are outstanding in that regard.
How do we battle that? I mean, because and another case outside of that one was somebody that was somebody in their 20s that was talking to AI and was talking about their thoughts of suicide, and rather than point them towards help, it was kind of telling them how to do it.
It's following the programming.
Yeah, it's telling them how to do it. What's the most successful way? And that's, my gosh.
I mean, we've got to have safeguards. I mean, there's got to be guardrails there.
Well, AI testing and implementation early in the conceptions of how these things would look, it's this idea that you'd create AI in a vacuum, in a sterile environment, and then you test it out to make sure it was safe, and then you release it into the wild. Well, what we're doing instead is a race to have the best AI in real time. And so you see several companies who have created an AI, and they want to be first and best to market. And so I think as the large language models are refined, it will capture these things we're talking about and hopefully continue to improve. But so far, we're still seeing these cases where there's bad outcomes.
Yeah.
No, it is dangerous waters out there, and people are always looking for a way, that self-care. You're like, okay, well, I don't want to talk to a real person because they're going to judge me, so I'm going to talk to this AI person, right? It's like easier because there's not that personal relationship.
And I think that's especially true for young adults. It's the same reason why chat and text, even with 988, we have chat and text available, not just a phone call, because teenagers and young adults typically are going to chat and text and not do a phone call and not talk to a human. They don't want to necessarily talk verbally to a human, and that's where we're seeing a lot turn to AI as well. So I think that's where us as adults and as society have to acknowledge that this is a concern and this is a problem and have conversations with our kids. We have to be the safety rails. Until those safety rails are developed, we are the safety rails for our kids. And making sure that we stay up to date on what is going on. Like I had to learn what 6'7" means after my 14-year-old kept coming home and saying 6'7" all the time. You've got to learn the lingo.
I had to too. I'm not ashamed. I had to look that up too, and I still don't quite know what it is.
Well, I looked it up on AI, so let's just say that. But I mean, we have to have those conversations, especially with our young adults, because we have to tell them that's not another person on the other end of when you're ChatGPTing or AI or whatever program you're using. It is artificial intelligence. So it's really having those open conversations, again, which are sometimes difficult to have, which also means then we as adults have to learn it too.
Well, and it goes back to that point that if they're not going to police themselves, they're going to need a government entity to perhaps do the policing. And when you talk about...
Sound like a job for Department of Mental Health.
Well, that's what I wanted to get to, that we look to government to help provide resources and things. Where do you all see that going? Because I know you guys are great champions. Everybody that works at mental health, fantastic. Everybody at the Department of Health, fantastic, wants to help everybody. But do our lawmakers, are they starting to see the investment that's necessary and the return on investment that they can get out of this?
I believe so, absolutely. Even just in the last few years, let's just go back 2 years, 2023. We've had significant pieces of legislation that has passed in the state of Mississippi. I'm not talking on a national level, I mean on the local level. I believe our state leaders and our legislators see and know the importance of mental health and are not just looking at it in a vacuum of mental health. Like Dr. Edney said, it is your overall health. There is no separation of mind and body. It is your overall health. And I've seen that through some pieces of legislation. They're not just looking at, well, mental health is state hospitals or mental health is community mental health centers. They're saying, okay, law enforcement has a role in this. We have our local government that has a role in this. We have our educators that have a role in this. It's not just the Department of Mental Health. So, for example, House Bill 1222, that legislation passed, and it's requiring mental health first aid for all law enforcement officers in the state, and it's requiring all law enforcement entities to have at least one officer trained in CIT, which is Crisis Intervention Team Training, a tool they need in their tool belt for when they go out and they're responding in the community. Just last year, House Bill 1640 completely changed the civil commitment process. It now, the very first step, if you feel like you have a loved one who may be a danger to themselves or others and they may possibly need that inpatient civil commitment level of care, you have a screening done with a community mental health center. That's the first step in the process. A mental health professional, not the chancery clerk, a mental health professional. So I think there's been significant progress. There's been legislation introduced around social media, around cell phones in schools. There's been legislation introduced about transportation issues. We know that a lot of times people cannot get to their mental health appointments because they have issues with transportation. I think legislators in general, especially in our state, are realizing that it is a statewide issue. It affects all areas of the state, all corners of the state, all populations, all age groups, all demographics. We all have mental health. And we've got to address it in that manner as well.
Well, Dr. Edney, you have a great relationship with many of our legislators. Do you feel that same way that they're recognizing the importance of investing in mental health?
No, absolutely. I mean, they've assigned at least one task force that I know of focused on mental health of especially, K through 12 and really paying attention to high schoolers. I mean, the legislation that Wendy has cited, but then, and you can't just look at what the attitude is by the legislation that passes. There's a lot of legislation that performs really well that may not get all the way through. It may take 2 or 3 years, but it's still showing that they're paying attention. And I know in both the Senate and the House, we have really strong public health chairs that care about mental health and who understand the importance of global health.
Where would you guys like to see that go? Yeah, they've made some good first steps, but where would you like to see it go as we even get ready for this next upcoming legislative session? And I'll just open that floor about where you'd like to see it go. What's still in such big need?
So this may sound outrageous to some people, but I believe that Mississippi is poised to set a standard in public mental health care in the nation. We have a really unique set of circumstances where our executive director is trusted by folks in the legislature, where we've really put together a good team of folks in leadership and among positions throughout the Department of Mental Health. And I think we've challenged conventions that have led to reductions in services, and we are recruiting folks that I think the state will not believe how this plays out in the next half a decade. Other states have reached out for guidance on some of the problems that we've solved in Mississippi, which is wild. Sometimes they make a joke about, well, we must be in bad shape if we're calling Mississippi, but it's true. So as we continue to focus on how we can be great and set a standard, I think that's something that we will see in a relatively short period of time.
Wendy, where would you like to see it go?
There's a few areas of focus, exactly what Dr. Recore said. We've got an incredible team. We have a great team that are all rowing in the same direction, and I feel like we have great partnerships with other state agencies like the Department of Health. Again, we can't do this alone. I would like to see solutions for transportation. That, to me, is one of our biggest barriers in the state. We have a lot of, as Dr. Edney knows, rural areas of the state. We have a workforce shortage. In both rural and urban areas. There's a workforce shortage, and we need more people going into the behavioral health field. So I would like to see something addressed around workforce and how we can build a stronger workforce, especially within state government. Individuals who need services from the Department of Health, from the Department of Mental Health, they should get top-of-the-line quality services. And to do that, we need to be able to hire top-of-the-line quality people. So we need to look at our workforce in ways that we can recruit and retain, and legislators are needed to support those efforts. And then, again, going back to transportation, you've got to be able to have access. So you need the workforce to have access, but then you have to be able to have access by getting to your appointment. So having some way to address transportation, especially for individuals that are in crisis. We've worked a lot in the law enforcement field, and I think there's excellent work being done there. But in another area that I would like to see them addressed, and I know Dr. Recore and I are both working on this, is more psychiatric emergency services. We are seeing people go to the emergency room because maybe they are actively psychotic, or they are acutely ill and have a mental illness, and they can't be served at a crisis stabilization unit because of that level. So they're ending up in the emergency rooms, and you hear and read reports all the time nationally about ER boarding. We need to build resources in our state for psychiatric emergency crisis, psychiatric emergency services in different areas of our state. That's something that I would like to see addressed. And then also more emphasis placed on our schools and making sure our children go to school and spend the majority of their day there. And we need to make sure that they have access to counselors and to therapists and services that they need, and that our teachers and our educators and our workers in the school are very well informed on how to recognize issues and then what to do. What are those next steps to do? And I think these are all things that the legislature's looking at. Like was said earlier, you don't get legislation passed in year one. It takes a few years. And they're working on it, and there's a lot of support behind it.
Well, Dr. Edney, the health department saw some success in transportation to health, where you had the contracts in place to help get people to medical appointments, to their county health department or other appointments. But that was very reliant upon having Uber drivers, because it was with Uber.
Yeah. But it still works.
It absolutely works. But to Wendy's point, that you have to have enough people. And I know one of our challenges where there weren't a lot of Uber drivers, up in the Delta, to be able to get people there. But that was one solution that really was groundbreaking for you.
Yeah, it's been very effective. And the Rural Health Transformation Grant that is rolling out, one of the top priorities is looking at transportation comprehensively to facilitate access to care in our rural counties. And for all of healthcare, our transportation to health program is for public health. Other state agencies can piggyback on it without having to procure it, because it's already been done. But, Greg, when I'm looking at mental health issues that impact health, we have a real problem with child death. And we score very poorly in the Kids Count report for child health. We're literally dead last. The leading cause of death in our children aged 15 to 18 is homicide. And then very quickly going down to 12-year-olds, suicide. And
as low as 12, really.
And so we lead the country in firearm-related deaths. And many of those, of course, virtually all the homicides are firearms. And many of the suicides are firearm-related. But even with our infant mortality work, we're seeing 6-month-olds die from gunshot wounds. We're seeing infants that are being murdered. And that's all that, even there ties to mental health. The mothers and families under stress in the postpartum period, those situations put infants at risk. So mental health really just transcends so many issues, but we have got, just as Wendy said, we have got to focus on comprehensive health of our children and health promotion for our children, because even if we can help them, survive and graduate from high school, we don't want them dying when they're 42 from an unnecessary stroke. So accidents are a third leading cause of death in the state for the whole population, and a lot of those accidents are children, young adults. It really knocks our life expectancy way down from where it should be.
I know one of the hot topics several months ago was about the number of beds that we have, facilities that want to open, both private, and public, Where do we stand on that, about having enough of those kind of facilities to be able to help people?
So for inpatient, there's a continuum of care, and we need to make sure that we have all components of that continuum of care in the state. You've got your crisis services, you have outpatient therapy, access to outpatient therapy, access to therapists, access to peer support. But when you get to the part of the continuum that's more inpatient, we have 188 crisis stabilization beds in the state. So those are located in 14 different crisis stabilization units in each region of the state, and those can be accessed voluntary or involuntary. There were about 3,800 people served last year in those beds, and they work. They have a 92% diversion rate. 92% of the time, if you go into a crisis stabilization bed, you do not have to go onto a state hospital. That crisis can be resolved. It's about a 10-day average length of stay, and you can go back home and be connected with those services in your community. So we have 188 of those beds. We have vacancies every day somewhere in the state, but again, it goes back to transportation. The vacancy may be in North Mississippi, and you may live in South Mississippi, but the vacant bed is in North. So it's a transportation issue still. And then on the acute psychiatric beds, and that's what a lot of times you'll hear about in the media, those are beds that the state operates at 4 hospitals, and they can only be accessed through a civil commitment. So it is the highest level of care that's needed. There are approximately 320 acute beds across the state in that level of care that the state operates, public beds. We are struggling with staffing in a few different areas again. And then those beds, though, are typically around between a 25 and a 35-day length of stay. We are seeing individuals, though, that have serious chronic mental illness that may need longer stay than that acute psych stay. And that's where Dr. Recore and I are working on making sure that those individuals that have had multiple readmissions to a hospital and may need a little bit longer length of stay due to the severity of their mental illness have access to that care as well. And that's one thing that we're working on now. So it really truly is having a continuum of services that are available in all areas of the state that people have access to when they need them. And that is how you have a successful system. And it's all about the person. It's all about the person needing the service. So they need to have the service they need when they need it available.
Well, and I think also you in anything, government can't do it all. We need private partners to be able to help us. Dr. Recore?
Yeah, I mean, what I would say, since we've been discussing this, the emergency psychiatry angle, we've had several folks from the private domain say, we want to be part of this. We know this is needed in the state. We have an understanding of how payment works for uninsured folks and what federal resources there are. And what I would say is, since Wendy and Dr. Pickett from North Mississippi and I went and discussed this with folks that could make some changes, what became really clear is everyone says, well, if this comes from the big, beautiful bill money or somewhere else, we need this. It's the top of the funnel. It's no wrong door for people who are in crisis. And ERs are more than excited to have some place where they can send folks that are going to get the care they need, rather than housing folks in beds meant for people with medical conditions other than schizophrenia or bipolar disorder.
Well, Dr. Edney, it's one of those things we got to keep the pressure on, right? To keep telling the federal government this is needed, to tell the state government this is what's needed. Don't take the foot off the gas now.
I mean, it's all about maintaining awareness, and Wendy's done a great job at the Capitol, keeping before the decision makers the importance of the needs for mental health for our population. And then what we're doing today is trying to maintain awareness among just, the folks out there. These things are important. For every challenge, every problem, there are solutions, and it usually means us all working together. And so public-private partnerships are critically important. Not only can we not do it, but there are many times we should not be the ones doing it. It's much better for someone to have a private provider who knows them, is taking care of them, knows their family, versus the state entity going in to handle a crisis or plug a hole. But it usually takes all of us working together.
Well, I have to tell you, I learned so much. I mean, this was absolutely fascinating. I can't thank each of you enough for coming in and willing to talk about this topic, because it kind of flies under the radar sometimes, but I think it's not taboo anymore, and we need to kind of pull that blanket back. Last thing, lightning round here. Last thoughts as we enter this holiday season. Just kind of take us back. Some quick advice that you'd like people to know to help get them through these next couple of months. Dr. Edney?
Everything in moderation. Everything in moderation. So, alcohol, salt, sugar, sweets, everything in moderation.
I thought calories don't count over the holidays, Doc.
Unfortunately, they do.
You'll pay for it later, right? That cholesterol. Dr. Recore?
Sure. There were some studies completed that looked at people's emotional reactions and checked in on mood over time when they looked at things like Lifestyles of the Rich and Famous. I don't know if that show is still on, but
I remember it.
Super.
Robin Leach.
They spent some time looking at posts, ultimately social media posts, for people who are much more affluent than them, and then measured what their mood was like over a period of time. And then they had another group that looked at people who were doing less well than them. And it turned out that their mood was better when they looked at these social media posts for people who are doing obviously less well than them. And so we all sort of, I think, have experienced a time where we were generous to someone that was not doing as well as us. And there is a real joy that we experience in our hearts, right, in our body, when we live that way. And so it's not to say over the holidays focus on others, but that's actually a remedy for what often ails us at the holidays, which is a feeling of lack, comparing ourselves to people that claim to have everything on social media. It actually, even if the reason you're doing it is because you want to feel better, fine, it'll work. It's a way to think about things that are both helpful to those around you, and you might feel a little better too. So that's it.
Yeah. Hit that Toys for Tots box up,
That's
fill that Salvation Army kettle, and it'll all give you that warm and fuzzy inside that you're helping other people.
That's right. Whatever it takes, get that warm and fuzzy and feel some contentment about what you actually have in life.
Excellent. Wendy?
Resources. So many times we don't stop and see the billboards or hear the radio commercials until we're needing the resources. So if you find yourself this holiday season needing resources, 988, 24 hours a day, 7 days a week, you can get a trained crisis counselor to talk to. 988, easy number to remember. And then Mental Health Mississippi, we have a free app that people can download, and they can find out what resources are available in their county, directly access their mobile crisis team number, get connected to 988, have free screenings to determine if maybe you do need to talk to someone. And then that's also a website, mentalhealthmississippi.com or mentalhealthms.com. So we have app resources on the website and then 988. So if you do find yourself needing to talk to someone, someone is there.
Excellent. Excellent stuff. Wendy Bailey, Dr. Thomas Recore from the Department of Mental Health, Dr. Dan Edney from our State Department of Health. Thank you all so much for being here. We appreciate you very much. Well, that's going to do it for this edition. Remember, as you head towards Thanksgiving, don't overcharge because the credit card bill is going to come after Black Friday. You're going to feel real good about it on Black Friday, but when that bill comes in and you got to pay that in January, buyer's remorse for sure. And, just take care of yourselves. Take care of yourselves and enjoy the holidays. That's what it's all meant to be. And if you need help, again, utilize the resources that we talked about here. Well, we hope you guys have a great November, and we'll be back to talk to you again next month. For now, I'm Greg Flynn, and this has been Health Talk Mississippi.